my name is Anita Chan. I'm the program coordinator at Arthritis Consumer Experts. I'm here today at the Canadian Rheumatology Association annual scientific meeting in Quebec City. And I'm here today with JoAnne Marcuz. And JoAnne, welcome.
Thank you.
Do you mind giving our audience a brief introduction of yourself and what you do?
Sure. I'm a physiotherapist. I work with the Rheumatology division at SickKids, and I've had the pleasure of working there and with the division for nearly 10 years now. And I do a lot of the frontline fun stuff with the kids, both with inpatients, outpatients, clinics, and day patients as well.
What do you think about the use of social media in patient care and medical research?
Regarding patient care, I think it's a great forum, especially with our children and adolescents who are more and more wired, and probably going to be more so as we go forward. So I think it's great for the patient care bit just to make them aware of educational opportunities and resources that are available to them. For the medical research, I think it could be used to help to raise awareness about what research is being done, but also raise awareness about the strides being made. So, I've heard the feedback from some families and patients that they are happy to and are eager to participate in research, but they don't always hear about what happens afterwards, what questions have been answered, or how they've helped to contribute to this. So I think it would be a good way to communicate that to them. I was just going to raise awareness as well for us. We're looking at SickKids about trying to look at Twitter and Facebook and how we might be able to raise awareness about the research, the medical research, and the patient care, so resources and events for patients.
And how young are some of the children with juvenile spondyloarthritis?
Yeah, so a lot of our kids are teens, but we could see it as young as 8 to 9 years old.
And how important is exercise to them in terms of coping and managing their disease?
Mm-hmm. It's very important. Kids participate typically in so many things: sports, recess, gym, just going to the park with friends. So not being able to participate in these activities can have a real impact not only on their emotional health and their physical health, as we know. And in particular, we often have discussions about, the importance of being strong, flexible, to support their joints, not just now, but also in the future.
Can you share one or two of the practical tips for translation to clinical practices and why they are important?
I think one practical tip would be to ask the patient, the child or the adolescent, what their interests are as far as activities or sports. Try to get a feel for what might motivate them to become more active and help them to develop some SMART goals around what activities they're interested in, whether it be perhaps group versus individual, that type of thing. Another practical tip would be not to underestimate the importance of a physical exam. A lot of kids, it wouldn't be unusual for an adolescent to come in and say they're feeling great, they have no complaints, but then you do the physical exam, look at the peripheral joints, their enthesitis, the movement in their spine or the hips, and you'll find perhaps some impairments or active disease that needs to be addressed.
And do juveniles with JSPA get hands-on physical therapy, or is it more a matter of you designing appropriate exercise regime for them? If the latter, how do you motivate them to start and build this exercise?
Yeah, it's both, really, depending on how severe their disease is. So we do have some kids that present that have really severe and debilitating disease. They may be admitted to hospital. We may need to do some hands-on therapy, more intense therapy, to help them maintain their range of motion, facilitate movement. We really find hydrotherapy to be key with these kids to work on normalizing their gait patterns, maintaining their strength and their flexibility while we're waiting for the medical intervention to really help to control their inflammation and help them feel better. But luckily, the majority of our kids can make do with just a tailored program, as mentioned. So we actually have developed a module on aboutkidshealth.ca that I often refer to with the kids, and it's really sort of a package of exercises and stretches and a little bit of education too, that we can go to, and I usually try not to give more than a few exercises or stretches for them to work on at home. And I find that generally is enough. Sometimes the adherence might be an issue. They are teenagers. So if at follow-up it seems like there's some issues, then I try to work with the family to find a physiotherapist closer to home. And usually I find short bursts are enough for these patients to help them, whether it has to be some work on flexibility or movement to be enough. And then when appropriate, we know group-based programs are much more beneficial than home-based. So we try to work, or I try to work with families to find a sports activity or some sort of group-based activity that they can get involved in as well.
That's really great, because I was just thinking, I'm like, attention span of kids are not that strong, so like they're shorter usually. So
well, I think if you look at adherence rates with stretches and exercises, even adults won't follow through on even a couple exercises.
I guess the kids learn from their parents.
Yeah.
Should family physicians know more about JSPA, or are most cases getting identified and referred?
I don't think we really have accurate numbers to answer that for you, but we really are working hard to try to just generally raise awareness about JIA, and hopefully in the process we would also be capturing the family physicians.
Parents worry endlessly about the health and well-being of their children. What are the biggest concerns of parents with children living with JSPA, and how can those concerns be addressed?
Yeah, I think because of my role with these families and the patients, the biggest concerns that are raised to me are about return to sport. When are they going to be able to ride their bike again and participate at school fully? Those sorts of things. And I hope that something that I share with them helps with these concerns is to say that I do not have one child or adolescent with treated juvenile spondyloarthritis in a wheelchair. I do have several that compete at elite levels and participate fully at school. Okay? They may have to work to get back to that point, and it will take some work and a little bit of struggle for some, but together we can get there.
That's great, and it's really great to, do you guys have that information at the website? Do you guys highlight the
Probably
success
not that
stories?
word
No?
for word,
Okay.
but I think it's a great idea. We should have some success stories. We have some general stories of children living with arthritis, but it would be a good idea to try to include all the different subspecialties.
Great. Thank you so much, JoAnne.
You're welcome.
And
Thank
I
you.
hope you enjoy the rest of your time at the CRA meeting.
Thank you.
Thank you.